everyone, this is Dalene Barton with naturalfertilityinfo.com, and today I'm going to cover common misconceptions for fertility herbs and some of our fertility herb programs. There's been a theme lately of questions within the questions that we receive where there's a lack of understanding maybe of how fertility herbs work in the body, why they need to be taken so long, and kind of having some askew expectations for your fertility journey and your healing process, as well as how long it may take for you to get pregnant. So I just wanted to cover those so that we can clear some things up. I understand that for me and Heather, herbs come really naturally. They're a part of our life, and they've been a part of our lives for many, many years, but for some of you, this is really all new, and so it's hard to understand maybe why we set the programs up the way we do, how long the herbs actually need to be taken, etc., etc. So, the most common misconception is that if I take, say, a bottle of Vitex for a month, that my PCOS is just going to be cured. Or if I do the Fertility Cleanse kit, am I going to be pregnant right away? How long will it take me to get pregnant? If I do your PCOS fertility kit or EndoWise fertility kit, am I going to be cured? I'll never have to deal with that fertility issue ever again. So that misconception that the products are a cure-all, that you're just going to magically be healed. I think a lot of times women think as well, okay, so I had endometriosis, I used the products, and I got pregnant right away. That still doesn't mean that you're cured of your endometriosis. So, let's just be clear right up front. Herbs take many months to be effective. The programs, each of our kits contains about a 1-month supply of products, but in general, they're suggested to continue for 3 to 6 months for results. You probably will not achieve results right away, but some people do. Is this going to be a cure for the rest of your life? There's no way for me to really answer that. Each couple brings a lot of different fertility issues to the table a lot of times. Each woman is unique in her body, her partner's body is unique, and there's just no way that one thing can cover all of that for everybody. So, some women and couples it's going to take longer, and then some people are going to find that they're getting results right away. It also depends a lot on your diet habits, how you're living your life, certain choices you're making. Like, do you drink and smoke? What your stress level is at work, in your daily life, how much you're paying attention to your fertility, how much you're trying. I know that we live in a society where we really value, for some reason, instant gratification. Because, yeah, it feels really good if something's just taken care of right away. We just pop this pill and it's gone. But honestly, even Western medicine, if IVF sometimes takes many, many tries. Clearing your fallopian tubes, they may become blocked again. Surgical procedures to remove uterine fibroids and endometriosis, things may come back. You may be taking fertility medications that take hormone, that have synthetic hormones, those aren't even guaranteed to be effective, 100% effective. So we have to look at the long-term picture and really make some goals and be realistic and be honest about those goals and do some research on what we're interested in. And being realistic and honest to yourself is saying, hey, I have these issues. What is the reality that I'm going to get pregnant right away? What is the reality that I'm going to feel results instantly? Probably pretty good if I'm committed. Am I going to achieve a full cure right away? Probably not. So just being very clear and realistic with the overall picture of your personal fertility journey. You know, supporting yourself, being loving and patient and compassionate toward where you are at on that journey is very important. If I take more than the suggested dosage of a product, will I achieve quicker and better results? I have people write in all the time, I would like to take this many milligrams of this, even though the suggested dosage that it says to take is this. Is it okay for me to take double that? Will I get pregnant right away? All these different questions where more equals better and faster. And for natural healing methods and for herbs especially, that is just not true usually. It's never a good idea to exceed the suggested dosage of any products. One, you could get very sick. You might actually hinder or set back your progress that you're making, and that would just not be good. So those guidelines are there and those suggested dosages for a reason, and that's to keep you safe. Those are also what has been shown over time to be the most effective dosage. Excuse me. So next, do I really have to take herbs or the programs for many months for them to be really effective? Yes, you do. The herbs take time. They work with the body. They're not like a medication that's having a direct action, telling your body, forcing your body to have a result that has been created in a lab. So they work with the body over time. They provide lots of nutrients and other essential things that are supportive and really have health benefits for the body. And it's been proven that if you can be consistent with them daily, within the month of your cycle, however they're supposed to be taken, it's different for every herb. So be sure to do your research on herbs that you're interested in and just be consistent. Set up a 3 to 6 month program for yourself. Lay it out. I've talked about this before, writing down what you think you may need, doing the research on it, laying out a month-to-month plan. If you need help with that, we have consultations. If you're not sure what herbs might be right for you, we have some great resources. So we have a fertility herbs guide under fertility remedies at naturalfertilityinfo.com, and then we also have a fertility herbs group at our natural fertility community, which is a great place to ask questions and to read older threads. Will help you to learn. It'll also help you to meet other people that are maybe interested in some of the same things you are, or are experiencing similar things and have found results through herbs or found ones that didn't work for them, just so you can get an idea, a picture of what you're looking at for your program. And then write us. You can just contact us with a specific question about an herb if you have any doubts. If you're not sure where to begin, honestly, it's great at naturalfertilityinfo.com. On the left-hand sidebar is the Fertility Solutions tab, and under that lists all different kinds of fertility challenges. You just click on that and it will show you the best natural remedies for those conditions. Now, if you have a specific herb and you're not seeing it on there, or you're not seeing whatever you're looking up, we have a search bar and you can do a search and it's going to bring up any related articles, and that'll help you as well. If you have any questions, please don't hesitate to ask us. If you have any specific questions about herbs or the program or misconceptions of anything, please let me know. Post it to this video, and I hope all of you have a wonderful day.